Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. There are no new cases of COVID-19 to report. Our total number of cases remains at 292. As of this morning, there are no cases in hospital or in ICU. As of this morning, 271 individuals are listed as recovered, and we have 14 active cases. Yesterday, 1,145 lab tests were performed, and that brings our total to 40,466. We've been able to gradually increase our gathering sizes, but physical distancing is still critical. Manitoba's plan for Phase 2 of services is going to be effective June 1, as it was announced earlier today, and it's going to allow for the gradual reopening of more services. But again, this is not a return to normal. This is a broad reopening, but with restrictions. We need to continue to stay safe as Manitobans. We know this virus. We need to be aware of this virus. We're going to need to learn to live with this virus. And staying safe includes physical distancing, keeping 2 meters from others when at all possible, washing your hands frequently disinfecting frequently touched surfaces. And again, vital to our recovery is going to be staying home when you're ill. We can no longer fight through a cold at work or be out in public with a cold. So certainly our testing has broad criteria, so any symptomatic Manitobans can present for testing, and I encourage you to do so. But it's vital that people stay home when they're sick. It's vital that employers have in place the ability to screen employees to ensure that people aren't coming to work ill. So again, the symptoms of COVID-19, cough, fever, chills, headache, sore throat, hoarse voice, runny nose, fatigue, and others. I'd encourage Manitobans to get tested, even if they're very mild symptoms, even if you're not sure. Get tested. As we reopen things, it's critical that we're going to find cases early, isolate those cases, and do thorough contact investigation. Wash your hands frequently, cough into your sleeve. Taking these steps are going to help reduce the spread of COVID-19. Those that are at a higher risk of the severe outcomes of COVID-19, those over age 65, those with underlying medical conditions, those with immune compromise have to take extra caution. You need to limit your gathering in crowded spaces, keep the group sizes low, continue to wash your hands frequently, but you'll need to take extra cautions as we continue to reopen things here in Manitoba. Businesses that have questions about how the orders apply to them should reach out to us through engagemb.ca. And of course, Manitobans should continue to access our website at manitoba.ca/COVID-19 for up-to-date, credible information. So again, thanks to all Manitobans who have stepped up. That includes businesses, and all Manitobans that have really adhered to our messaging, have taken this virus seriously, and has put us in this position now to enter our Phase 2 of a reopening strategy at quite a safe time. So thanks again, and I'll pass over to Lynette.
Thank you very much. My name is Lynette Siragusa. I am the Chief Nursing Officer with Shared Health, and I wanted to highlight today the work of medical students who have spent much of this pandemic working in our intensive care units to virtually connect patients with their families. Visitor restrictions were put in place at all hospitals and health centers more than 2 months ago to limit the spread of COVID-19. And this strategy has been successful with its principal aim of reducing the spread of the virus, but we definitely understand that it has not been easy for patients or their families. As restrictions are gradually lifted during this phase of the pandemic, we will also be continuously reviewing our visitor guidelines and ensuring that case-by-case exceptions continue to be available for those who need in-person visits. Much of our activity over the past few months will include asking our health facilities to look at opportunities to use technology, continue using technology to support the important connections between patients and their loved ones. Support for these virtual connections has to date so far been largely supported by medical students from the Max Rady College of Medicine at the University of Manitoba. And they've been volunteering their time to act as family liaisons in the intensive care units across Winnipeg. These students act as technical supports for patients, setting up video conference meetings with family members and helping them operate their devices. They also screen patients and families who may benefit from the involvement of spiritual care, social work, or Indigenous health supports. These students have helped their patients stay connected to loved ones at a time of considerable stress, and we congratulate them all on a job well done and wish them well in their studies. I would also like to give a special thanks to Dr. Candice Olafson for organizing this thoughtful program. I also wanted to give a quick update from Monday's report on the health of our clinical staff. The number of staff who have tested positive for the virus for reasons that are not related to travel remains at 26, and I'm happy to announce that the one remaining active case has now been cleared. So all 26 staff members have now recovered from the virus, and we are thrilled to have everybody healthy and back at work. And we'd like to congratulate all Manitobans, including healthcare providers, for their diligence in preventing the spread of this virus. Finally, 2 months ago, we encouraged retired nurses who were interested in helping in the response for COVID-19 to step forward. And we had 21 former nurses from throughout Manitoba respond to the initial call for support, and they were hired into the COVID-19 casual pool. 10 nurses have already accepted available work, and as opportunities arise, the remaining nurses will continue to be offered positions where their skills and support would be very welcome. These are in addition to the many staff throughout our health system who were redeployed during the first wave of the pandemic into areas where help has been required, including occupational health, as staff and visitor screeners at the entrances, and to catalog donations of PPE and other supplies at the various donation drop-off centers throughout the province. These donation sites were opened following our call for items to supplement the provincial supply of items vital for our COVID fight. And we had a tremendous response with Manitobans stepping forward to provide tens of thousands of masks and gowns, hand sanitizers, and other supplies. As we move into this new normal phase and clinical and other activities begin to ramp up, the province's coordinated procurement efforts through traditional and new vendors will continue. And these donation sites will be closed and their staff move back to regular duties. So we thank all Manitobans who have donated over the past 2 months, and we thank all the healthcare workers and students for their professionalism, dedication, and flexibility as we work together to ensure Manitoba's health system is ready to respond to this virus. And with that, we can open the line to questions.
Thank you very much. A reminder to our reporters online, you'll have one preliminary question and one follow-up question. Up first this afternoon from CTV Winnipeg, John.
Hello, it's John Hendricks from CTV Winnipeg. My question is for Dr. Roussin. I'm wondering, with more businesses that will soon be reopening, I'm wondering what your advice is regarding employees who are currently working from home. Should this practice continue?
Right. So, so what we always been saying is that we're in a new normal. And so things like physical distancing are going to remain important. Avoid large indoor crowds is always going to be important moving forward. And so businesses that were able to move to virtual work, to working from home, virtual meetings, all these things, if that worked well, then yes, I would encourage you to maintain those activities. There's no real reason to go back if they've been working well. And so, as a business, they're going to have to evaluate these type of things individually. But if that was working well, there's no reason to really go back. We are in a new normal. We're not returning to normal. We're finding ways to live and to reopen with this virus. So any steps that can still prevent people from being crowded places unnecessarily are going to be beneficial.
Thank you. As a follow-up, I see that senior centers and clubs will be allowed to return. I'm just wondering how risky that will be for people in this age demographic to be returning to a group setting.
Yeah, and so this is all a balance, right? So there's more to health than just this virus. And so certainly at this point, this virus is still, we need to be aware of it and paying a lot of attention to it. But there's other benefits from these type of group organizations. And mental health, physical health are some of them. And so it's a balance. Again, it's permissive, so no one is directed to attend these. We do have a lot of specific guidance to these areas. Again, we recommend smaller group sizes than what's allowed in general, and then certainly the overall messages are vital. Is to, even when you're out, try to maintain that physical distancing. No one should be attending here ill. Should have an appropriate way to screen people to ensure there isn't anyone there ill. So it is that balance, and Manitobans have been able to achieve that balance and make informed decisions on their own.
From City News, Stephanie.
Heather Stephanie from City News. Dr. Roussin, would you describe phase 2 of reopening as aggressive?
I would describe it as an appropriate timing, appropriate response to what we see at the levels of the virus here. So we're into the second incubation period after phase 1, and our numbers have been able to maintain a favorable level. And so we've moved now to what we would say is a broad reopening, but within those reopenings, there's restrictions. And I think it's a real safe plan, but it's a plan that also recognizes that Manitobans have really stepped up to put us in a position here where we can safely start gradually reopening things.
And how many health inspectors does the province have employed to monitor things as we move into phase 2?
That's a good question. I don't have a specific number for that. The health inspectors have always played that role of education first, because, like we've said many times, Manitobans have been great at adhering to our recommendations and to the orders. Rarely we'll see certain industries or businesses that aren't complying, and almost always all it takes is a bit of education to get them to adhere. And then rarely we need to use some enforcement measures. So we have adequate ability to enforce these, but most times we're not required to.
From the Winnipeg Free Press, Danielle.
Good afternoon. This is Danielle De Silva from the Winnipeg Free Press. Dr. Roussin, when could Manitobans expect the active case count to reach 0? And what would that mean from not only a public health perspective, but also an economic one?
Yeah, I think that's, the active case count is really a reflection of time that, almost always within 14 days of being developing symptoms, almost all those people are going to be labeled as recovered 14 days later. So it's more of a function of time. So, we expect to see that number continue to remain low. Although, Manitobans need to get used to seeing this virus. We're going to see more cases. And so the things that we're following, like our positive test rate, things like the number of cases that can't be linked to a case or to travel. Those are the real important things that we're going to measure. We're not going to be thrown off our progress by seeing cases here and there. We're going to watch that positive test rate quite closely.
you. And as a follow-up regarding the phase 2 reopening plan, what test positivity rate or number of hospitalizations would trigger restrictions to be brought back into place?
And yeah, so on these numbers, there isn't one number that we're following. We're following a number of the test positivity rate, the number of respiratory visits to ER, the non-EpiLink cases, which I measured, or some of the disease transmission. We measure the vacancy of ICU and medical beds. So we take a lot of things into account. So there's no one number that's going to tell us that we need to change what we're doing. It's going to be the trend of those numbers and how many are giving us a signal. So it's not as simple as just one number that would change our progress.
From Global, Brittany.
Good afternoon, Dr. Roussin. Brittany from Global. With the second phase of reopening that includes team sports for youth and adults, can you tell us how it's possible to physically distance in some of these sports, or what kind of things you might recommend for people moving forward to resume these sports?
Yeah, and so this again is that balance where we've been able to put ourselves in a position where we're seeing minimal activity of this virus right now, and the balance of the mental health, the physical health of being active. So you'll see in our guidelines that we certainly acknowledge that we can't maintain a 2-meter physical separation between people while we're playing these sports. We can certainly limit the crowd sizes. We can certainly limit and ensure that there's physical distancing on people who aren't participating. And then while participating, it's right back to the basics of what we talk about, is that there can't be anyone showing up to those games who's ill. So there has to be a very good screening process because we can't have people playing in those conditions when they're ill. There has to be a lot of sanitation, a lot of hand sanitizing, and really just everyone staying home when they're ill, and that's that balance we have to come to. We're not going to see in the foreseeable future when we don't have to deal with this virus, so we need to find ways that we can live with this virus. So we have to start returning to some sense of normalcy, and we think that the numbers that we see right now, and putting in all these guidelines, we can return to those sports in a safe manner.
Thank you. And I know this question was asked to the Premier this morning, but as we start to reopen more businesses, are you going to be looking at possible restrictions of travel to provinces that are more hard hit than we've been, such as Quebec and Ontario, to protect Manitobans from having the disease, or the virus, brought back further into Manitoba?
Yeah, so right now, given Manitoba's current numbers, one of our biggest risks is importing the virus. And so certainly the travel outside of Manitoba has been discouraged by public health for quite some time now, and it continues to be discouraged. And so we probably won't be in a place where we restrict travel, but what we do is anyone returning from outside of Manitoba, with a few exceptions, is required to self-isolate for 14 days. So should they develop COVID-19 from their exposure outside of Manitoba, they're going to have a very limited number of contacts.
From the Brandon Sun, Kyle.
No questions at this time, thank you.
From CJOB, Diana.
Dr. Roussin, I know you previously mentioned you're working on something as far as using technology to track the spread of COVID-19 here in Manitoba. Earlier today, Premier Pallister says he'd like federal buy-in to create a sort of national tracking program, especially as people kind of start moving around more when things loosen up. Where are we on a possible tracking app or some similar use of technology right now, and what could that look like?
Yeah, and so we've looked at a number of apps for this, and definitely we'd be quite interested in having a national buy-in for this. I think that would put us in a better position than if provinces had separate type of apps that couldn't communicate with each other. But I mean, most of these apps that we look at are there to assist with contact tracing, And so it would be detecting close, prolonged contact with others, usually through Bluetooth technology. It doesn't tell people, it can't locate people, so it doesn't tell anyone where they are or who specifically they've been with. It just allows that if a person had tested positive, we could enter in a code into that phone and say it would send out information anonymously to people who may have been in close contact with that individual. So it just it doesn't replace contact tracing. It's an aid in contact tracing, but there's a lot of privacy safeguards in it. So we think that there's a number of apps out there that would meet our privacy requirements, and that Manitobans would be accepting of. But we're still ways away of before we have something to implement here.
Okay, and then just as a follow-up, back when the province unveiled its phased plan in April, there was kind of the possibility included there of loosening travel restrictions at phase 2 in future phases. That wording has since been removed from the outlines on the website. Will travel restrictions be loosened outside of the phases if rates of positive tests elsewhere go down to the point where you feel we don't need that 14-day self-isolation for incoming travelers, or will something like that be tied to a certain phase? What could that look like?
Yeah, and so we're going to follow the numbers, and certainly our travel, the requirements for 14-day self-isolation is all based on, the epidemiology in other jurisdictions. So certainly, if we see changes in that, we can change our travel, restrictions at any time. So it doesn't necessarily have to be tied to a phase. It's tied more to the numbers that we're seeing.
From the Winnipeg Sun, Scott.
Hello, Scott Billick here with the Winnipeg Sun. Question for Dr. Roussin. Just wondering, obviously a large uptick in testing done yesterday. Is there a specific reason for that? Was there quite a bit of asymptomatic testing yesterday, or a lot of more people with symptoms presenting at testing sites?
Yeah, I don't have all those details from yesterday's testing. I know that as we opened up the testing broadly, as we implemented some targeted asymptomatic testing, you could see that late last week we saw our numbers starting to trend higher, and then they drop, usually on the weekend. Usually that's because of demand, and so this is the kind of numbers that I would expect to see throughout the week, and maybe a drop over the weekends.
Okay, and just a question on part of the reopening in terms of obviously phase 1 it may be a little easier to I don't know if keep people in check is the right term, but with this such broad plan for phase 2, how much of this is just really on businesses, on Manitobans to kind of continue the work they've done, but kind of like an honor system or when it comes to businesses, because I assume it's nearly impossible to kind of monitor all of it right now.
Yeah, and I think that's been our approach from the beginning. As when we first saw a case here in Manitoba, we began the social distancing message. It was weeks after that before we had orders in place, but Manitobans have been following advice. So we need to have orders in place just to ensure that our messages are clear and that there is ability to rarely enforce it. But I think Manitobans have demonstrated that they take this virus serious, and they demonstrated that they know how to protect themselves from this virus. And so we put ourselves in this spot to safely start reopening things. And we're really going to continue to depend on Manitobans, on business operators, to really stay with these strict guidelines. Because if we do, then we're not necessarily that far from phase 3 and to continue our the reopening strategy.
From CBC Radio Canada, Laisa.
Hi, Dr. Roussin. My question will be regarding swimming pool. In the phase 2, swimming pool will be reopening. I'm just wondering, for people that will be using those services, what is going to be the process of cleaning? What will be different comparing to what it was before the closure?
Right, yeah, so I think we are talking about like as services open up, as businesses open up, what kind of like cleaning that's going to be required?
Yeah, especially a swimming pool.
Swimming pools. Yeah, so swimming pools. Our big concern is the occupancy. So they're going to have those strict occupancy restrictions and the need for that 2 meter separation. And so, as far as the regular cleaning, the pools are already heavily regulated on their requirements, and that's going to be sufficient in the pool, anyways, for the COVID-19 response. But certainly, frequently touched surfaces need to be disinfected regularly. And again, right back to what we keep saying is that we can't have people showing up there ill. And then there's also restrictions in locker rooms and change rooms. So, it all gets back to those. We have to reduce crowding. We have to ensure physical distancing. We have to ensure no one ill is showing up to these places, and in that regular disinfection.
Thank you.
From CBC Manitoba, Aidan.
Hi, my question is for Dr. Roussin. If we do start to see a spike in cases going forward, what specific businesses or services or sector of the economy would be reclosed first?
Yeah, so it might depend. So if we're not going to be looking just at, say, case counts. Case counts can be misleading. We're going to look at that positive test rate. We're going to look at things like the amount of cases that we can't link to known cases or to travel. But if we do see significant spikes in these or other indicators, then it's going to depend. Our epidemiology might guide us. It might show us where we're starting to see clusters, in what industries are giving us clusters, and we might have to work specifically in those areas. So it's really going to depend on what we see.
Thank you. And my second question, you heard from a family who's having difficulty accessing specialized care for their child outside of accessing emergent care. They would want to access their medical teams through an ostomy clinic, a physical clinic, a GI clinic, and saying those are still closed. So is there advice for when those will be opened, and what's your response to those families?
So our clinical leaders are working together to determine when they can open the ambulatory clinics and the community clinics. So I expect we'll be hearing information on that very soon. I know they're quite anxious to open up and make sure that people have the ability to access the services. And it might also be virtual services, if that's reasonable given the situation. So we'll update you on that as we hear.
From the Canadian Press, Steve
Lambert from the Canadian Press. Dr. Roussin, now with the expanded testing capacity, and you see over 1,000 tests done yesterday, are people able to get tested if they're asymptomatic? If people want to get tested but they're not displaying symptoms, can they go and get tested, or will they be refused outright?
Well, so what we're really focused on is the highest risk individuals. So those are people with symptoms. So we're certainly saying anyone with symptoms, even if mild, even if you're not sure, present for testing. We're doing targeted asymptomatic testing in certain areas. So it's not really our advice for people that aren't showing any symptoms to show up to be tested. We're not planning on turning people away. But it certainly isn't our advice to do widespread, indiscriminate asymptomatic testing.
And I can appreciate you may not have the exact number in front of you, but can you tell me how many asymptomatic tests have been done to date?
Yeah, I don't think I have that right now up to date on that. I know earlier in the week, as we first started, it's still relatively low numbers. It was in around the 250 mark, but that was a few days ago there, so it's likely higher than that now.
Thank you.
From the Flin Flon Reminder, Cassidy.
Good afternoon. This is Cassidy from the Flin Flon Reminder. With the a slight change to the northern travel restrictions. I know the recommendation was for travel from the north to the south be restricted as well, not ordered, but that was recommendation. Have those recommendations changed with phase 2?
Recommendations are remain in place. I think that certainly in larger urban centers and certainly remote isolated communities, we need to still be able to limit the chances of the importing the virus into those communities. But as we move forward, again, it's a balance. We've been able to deal with this virus up to now. But we're going to need to learn how to deal with this virus in the foreseeable future. We can't keep stringent restrictions on forever. And so that's why we thought that we could safely at this point gradually loosen some of those restrictions above the 53rd. But there's still a lot of caution, still nobody who's showing symptoms should be traveling. And when people are up in those areas where they must respect the remote isolated communities and their wishes on who should or shouldn't enter.
And what might the next step of loosening that travel restriction look like?
Yeah, I'm not sure if there's what the next increment would be on that. A lot of these decisions we're going to base on our epidemiology. At some point, just like any of our restrictions, they're going to be lifted. We can't keep these in forever. And so I don't really have a comment on what that next increment may look like. But we do know that if we continue to see numbers like this, we're going to continue to loosen our restrictions.
Thank you. We have some time left on today's session. If media have further questions, please ask them now.
Dr. Roussin, Diana from 680 just following up on the travel requirements for self-isolation, what are the chances the province would change that requirement on a jurisdiction-by-jurisdiction basis? Say someone from a province where there are very few active cases, potentially the Maritimes, were to want to come to Manitoba, would the province consider removing that restriction on self-isolation for someone where there is a very good epidemiology?
Yeah, things aren't off the table. We could look at that things like that as things progress. There's challenges with that. It requires the direct travel. Often people traveling from, say, a place with a lower epidemiology may be forced to travel through a province that has unfavorable epidemiology, and so how does the restriction apply there? So most of these things, it's best to keep simple, to not to have many things that modify it. But we'd always look at things depending on what we see with the numbers.
Dr.
John Hendricks from CTV.
I'm wondering if you could be relaxing the restrictions in hospitals or long-term care homes anytime soon, or when we might possibly see that. Are we weeks away from that, months away from that?
Okay. You want to talk about the visiting? Or?
For the personal care homes?
Yeah, and acute care, I guess.
Yeah, so we have, obviously, Brittany, we are in the process of opening up visitation outdoors for PCHs, and we are working with our acute care partners to look at how we can do that within the hospital settings. And I think we're going to have to continue to watch and be cautious of bringing that into indoor PCHs. Just because of the risk of the population, but we certainly are open to that possibility, but we're still going to kind of do it in phases and watch and be cautious.
John Hendricks from CTV. A question for Lynette. I'm just wondering if you can give us a sense for how the budget has been looking for the past couple of months. I know that with canceled surgeries and so forth, I'm assuming that maybe overtime has been maybe less than anticipated. Can you give us a sense for how the budgets are looking?
Yeah, so I have asked that question, and there's different entities, obviously, so within Shared Health and within the different regions and the organizations, and I believe central government is working to pull the information together, and we'll be reporting that soon.
Hi.
Question for Dr. Roussin, Diana again from CJOB. You mentioned recoveries are obviously a function of time. Have there been any cases that have kind of stretched out beyond that expected recovery time? And do you have any details on as far as how long those patients took to become recovered?
Yeah, I don't have necessarily details on that. So there's certainly individuals that have been admitted to ICU or to hospital likely would take longer to be labeled as recovered because what we say is 14 days from the onset of symptoms and symptom free. And so there's a certain proportion of people that their symptoms persist for longer, then they would not be recovered until we determine they are symptom free.
Hi, Scott Billick here from the Sun. Just a quick question: do we know how many, total, not just testing capacity, but how many, swabs, reagents, all that kind of stuff? Is there a total number of what we have available right now? Do you guys want me to know what that number is?
No, that would be a difficult number to come up with. There's testing going on, there's shipments being received, and so I don't think we'd be able to land on a specific number for that.
Okay, so would it be safe then would it be safe right now to open up asymptomatic testing to anybody who wanted it, based on the supply we have right now?
Well, it depends. It's hard to know how many people would take advantage of that. So it's not only about the capacity, right? It's about using the capacity appropriately. So we want to ensure that people with symptoms are being tested. And so we don't want to overrun sites with asymptomatic people going there, which could adversely affect the chances of a symptomatic person being tested. So there's a number of things going on. That's why we're mostly looking at the targeted asymptomatic testing.
Hi, Aiden from CBC News. Who precisely is involved and responsible for making the decisions about when and whether to proceed with reopening or pulling back restrictions?
Yeah, so this is a wide group, so it includes certainly public health, which I'm involved in, and central government, and then there's a lot of engagement with industry as well. So it comes through the incident command structure that we work on, and partnering with central government, and and then this process for sure showed a lot of engagement with Manitobans and with industry.
Dr. Roussin, Danielle here from the Free Press. I was just hoping to get some clarification on the Restoring Services Phase 2 report in which it says that one individual was hospitalized as of May 26th, but the bulletins have not reflected that. Can you clarify?
Yeah, so there certainly isn't any individual with COVID right now admitted to hospital or to ICU. When these numbers, this document's been in the works for quite some time, so it's probably a remnant of that actually. So certainly currently we don't have any admissions.
Hi, Aiden from CBC again. I was wondering about the rules on some of the arts activities, including dance and theater. Do that include performances? And if so, what are the restrictions, and why would that be safe as compared to movie theater?
Yeah, and so for the most part, we wanted to return to, to learning, to activity more than performances. So indoor performances are not going to be really in phase 2. So everyone's going to have to always adhere to the indoor requirements. So we wanted to make sure that people involved in learning and performing and practicing these events, just like sports, had that opportunity going forward with restrictions. But it's again that balance. But we're not really going to be seeing those large performances, certainly not in this phase. And it's going to really depend on when we could see those. It'll depend on our number.
And this concludes today's media briefing. Thank you.
Thank you.